from Windsor-West.
Thank you, Speaker. My question is to the Minister of Health and Long-Term Care. Speaker, earlier this month, when I asked the Minister of Health about CCAC slashing its services, he stated it just isn't true. Earlier this week, he described these service cuts to home care in Windsor as no cuts at all. But this weekend, in my riding, I will be meeting with more home care patients and their families who have been hit by these service cuts, just as I've done this entire month. People like Betty Terry, who's 89 and suffers from dementia, and Madeline Reitzel, who's 89 and has suffered from a stroke and needs constant care. With nursing visits slashed by 1/3, my constituents are being left without the care they need. They are told these service cuts are myths. Will the minister finally do the right thing, admit that these service cuts are real, and apologize to the people of Windsor for saying the exact opposite?
Minister of Health and Long-Term Care.
Well, thank you, Mr. Speaker, and I appreciate the question. You know, my job as Minister of Health is to ensure that those individuals across the province who do need care are provided with that care, Mr. Speaker, and we're doing that in home and community care as well. In Windsor, in Erie St. Clair, Mr. Speaker, we're not changing the criteria, nor will anyone have a change in their services unless their objective assessment indicates that they require a change in their services. And sometimes that's an increase in services, Mr. Speaker, and sometimes that's a decrease in services, but it's made by our care coordinators, our healthcare professionals, in a very objective way through assessment. In Erie St. Clair, there is no wait list for nursing care, Mr. Speaker. There's no wait list for PSW care through our CCACs. Everyone needing home care in Erie St. Clair is getting home care. That policy is not changing. We're adding additional funds, as I've mentioned before, to be able to accommodate any increases.
Thank you. Supplementary.
Thank you, Speaker. I have a quote from the first Vice President with the ONA. She states, I don't know whether he needs to come see, whether he needs to talk to the people whose services have been cut. I don't know why or how the minister can say there are no cuts. There is absolutely no excuse to cut home care services in Windsor, and no excuse for the minister to bury his head in the sand. These service cuts are spelled out in the CCAC memos, and patients are feeling the effects each and every day. If the minister really thinks that there are no service cuts to home care in Windsor, he needs to order that the home care services that have already been reduced be fully restored immediately. So why does the minister continue to deny that these shocking service cuts, not funding, service cuts to home care are happening under his watch?
Thank you. Minister.
Thank you, Mr. Speaker. And yesterday I had the opportunity to speak both with the CEO of the CCAC and Erie St. Clair, as well as with the CEO of the LHIN that has responsibility, and they're working together. In fact, there's a board meeting, an open board meeting today of the LHIN. The CCO is going to present, and I would encourage, I look forward to the member opposite, frankly, any members in this legislature, if they have specific examples, specific individuals that they feel are not receiving the care that they're entitled to. I expect them, I in fact believe they have a responsibility to bring those specific cases to my attention. The third party has not done that in any specific example of bringing their responsibility to bring those people to my attention, and I look forward to hearing from that. And I would suggest that they follow the lead as well of the member from Sarnia-Lambton, who is working with our LHIN, working with their CCA. It's their LHIN, their CCAC, and there's meetings taking place.
Thank you.